Hello, everyone, and welcome to our webinar. Be giving another members of the audience a couple of minutes, so we'll start in 5 minutes.
Hello and welcome everyone to this new segment of our webinar series from CCD Health, Strategic Scheduling Optimization for Imaging Centers, specifically focused on 3 steps to reduce patient no-show rates. As we begin today, I'd like to remind everyone to reserve your questions towards the end of the webinar. We will be addressing all of the questions that you may have. I'd like to welcome all of the old colleagues that we see joining us today and welcome some of the new colleagues that I see here for the first time. Joining me today on this webinar is my colleague, Mr. Edison Sepulveda. Edison is VP of Technology Services for CCD Health. Before joining CCD, Edison worked as a consultant for Ernst Young and for a credit bureau developing scoring methodologies and statistical models to access consumer credit risk for banks and other financial institutions. Edison received his undergraduate degree in information technology and an MBA from Barna Business School. He's also CFA chart holder.
Thank you, Carlos, and looking forward to sharing some useful insights with our audience today.
Absolutely. I am Carlos Ziegenhardt, the founder of CCD Health. I have over 20 years experience in the service industry, primarily focused on patient care support. Prior to founding CCD Health, I founded the telecommunications company SkyMax Dominicana, and I attended Manhattanville College. As we begin today, I'd like to start by giving you a brief overview of CCD Health, our specialized firm. For the last 10 and a half years, we've been specializing primarily on patient care support of imaging centers across the United States. We have the pleasure today of servicing over 200 imaging centers, both at a national level, regional level, and sometimes the local level as well. And it has been extremely valuable as we have learned from each and every one of those partners, our product offer that we have today. Our patient care specialists are doing an astounding 750,000 scheduled appointments per quarter. And we service today 3 of the top 5 largest radiology brands in the nation. As we continue with our webinar series today, we're going to be focusing on the high cost of no-shows, patient no-shows, which is an extensive research work done by our in-house business intelligence unit, led by Mr. Edison Sepulveda. After a year-long work in that area, we've come up with a significant approach to addressing this issue. An issue that plagues every imaging company that we have ever come across, to the point where significant missed revenue opportunities, underutilization of resources, delayed patient care among the most significant drawbacks and impact points that this has. After averaging an astounding 6.7% nationwide among all the imaging companies that we came across and that we targeted.
Yeah, Carlos. And what is even more concerning is that this 6.7% average is national. But what we've seen working with many partners in the industry is that when you have higher demand, typically this number tends to increase. And we've seen for most of our partners that are especially the large ones, but also those ones that are very well located, um, anywhere from 9 to 15%, which in the long run means millions of dollars.
It is very significant, and at the end of the day, as you well mentioned, it does amount to missed revenue at an average annual cost of missed appointments of over $1 million, which for any organization is a significant amount that needs to be addressed. Most of the companies that we engaged with have a very similar approach to dealing with no-shows. And when you look at this list, it may appear and it may seem to you that this is a significantly well put together steps towards addressing this. There's an initial confirmation either from the help desk, internal help desk, or one of the lateral teams within the organization. That is usually followed up by an SMS text message, and that is followed up by a staff call to the patient directly. Sometimes it's automated if they have the ability to do that internally as well. And then finally, an email is sent out. And most of these emails are in fact responded to. And as I said, Edison, when you look at this list and you look at all of these steps, it would seem to you that this is an issue that is, being addressed properly.
Yep, that's indeed the case, Carlos. They are dedicating resources, most companies in the space, dedicating resources to trying to tackle these no-show issues, understanding the financial impact it has. However, these solutions are either too costly to implement at scale or outright ineffective.
As we continue to look at this process and we continue to understand what the no-show rates impact is, CCD Health has come up with a three-step process to reduce patient no-shows, which Edison will walk us through.
Yeah, Carlos, what we found out working with dozens of these imaging centers partners that we have, and we came up with a framework of three basic steps that we want to simplify for our audience. One, you can manage what you cannot measure. So what we try to do here is collect all these data points, hundreds of them that we're going to talk a bit about, to try to measure what's driving this no-show issue. And armed with that information, what we set out to do was predict the no-shows using data science and machine learning enabled algorithms. And the output of all this is what we call a scheduling optimization. As we mentioned before, we've been working with scheduling for over the last 10 years, so it ties up to our core business. So what do we talk about when we talk about predicting no-shows? And I know some members of our audience, right, so far, listening to what we have expressed, may identify with the issue. And they may be asking themselves three questions. How do I take a proactive approach to no-shows? I have a lot of data. How do I leverage all these data assets that I already have? And especially, how can I know from my patient base which are more likely to show up to their appointment? So what we have developed is a predictive algorithm that can identify with a high level of accuracy which ones of your patients are likely to miss their appointments. And this is especially hurtful if it's a same day no-show, which we're gonna talk about. But first, we mentioned collecting information, right? Measuring results. And what we have here is a subset of the hundreds of variables that we use for our model. And I wanted to talk about some of them, Carlos, because I think our audience may find very interesting nuggets here. For example, when we go into distance to center, what we found out is that the farther the patient is from the center, the more likely they are to show up to their appointment. And this might seem counterintuitive. However, it's tied to some psychological issues where once you have invested some time into planning a 20, 30, 40 kilometer trip, then you're more likely to commit and stick to it, Carlos.
So that actually makes a great deal of sense, because at the end of the day, it's about formality, and it's about creating formality around the appointment itself. Many times, if you are very close to a center, you will look at the availability of an appointment as a continuous thing. You know, you didn't make it today, well, you're right next door, you can go another day. As opposed to when you're 20, 30 kilometers away, and now you may have to commit other people's time. You may have to look at carpooling, you may have to look at babysitting, you may have to commit a third party's time in order for you to make that appointment, and you're going to take it with a different level of formality. And that's another area that we identified, in this assessment that we made.
That's correct. That's very interesting indeed. Then we go to one that is more intuitive, and this is the insurance type. What we found here is that these patients that have to cover a higher out-of-pocket amount, so they have to incur some expenses, shell out some cash, are more likely to no show to their appointment. So that's something that you have to keep in mind when you're scheduling, that these patients that have either no insurance coverage or a low amount of insurance coverage may be part of that problem. And then we go, Carlos, into another one that we found very interesting, the imaging modality. And what we found here is clearly the lower modalities have higher attrition rates. But also what we found is that screening procedures and annual checkups have a much higher no-show rate than the ones that are diagnostic once your doctor has found some concerns for you, or your patient has found some concerns that might trigger that they actually stick to their appointment.
So that's an unfortunate and sometimes tragic reality of healthcare today. CCD Health, along with other healthcare providers, have been working on this concept of preventive medicine for as long as I can remember. We've been trying to implement, conscience around that, and education and knowledge around that, because in fact it is the case. When you have these ordered testings that are made, that the rates are much higher, as opposed to the preemptive annual checkups that need to be had. That is a tragic reality.
Indeed, indeed. And then last but not least, we analyzed the patient's previous behavior. And what we found here is that, as we all know, character matters. So those patients that at some point had a no-show issue, so they didn't show up to an appointment, are exponentially more likely to no-show to a future appointment. So this clearly speaks to the character of those patients and how they have performed in the past. So armed with that information, what we did was create a predictive model, as we mentioned, and the results were outstanding. If we divide in buckets of 5% our population of appointments, what we found out is that typically that top 5% tends to no-show at an average of 49%, close to 50%, which is a significant number. And then if you go to the top 10%, it means that close to 40% of all of your no-shows can be identified in that bucket. But you don't know who are these top 10%. So that's what the model tells you. With up to 90% accuracy, we can identify that top 10% days and even weeks before they actually no-show to their appointment. And that's where the power of all this comes in. Because that 40%, if you can reduce it, as we mentioned, it means for a small center, hundreds of thousands of dollars, for a large center, millions of dollars.
Absolutely. And I'll say it again, because it's important that we understand and we can convey this. These two strategies that are going to be presented now are the culmination of a year-long research that was made by the CCD Health internal intelligence team. This year-long research was focused on finding a fact-finding analysis from all of our major partners, national, regional, and local. And these two strategic models that we're going to present now are the culmination of that. And so that's why they are the essence of what we're presenting today.
Yeah, indeed. And Carlos, I know all of our audience members, they want to find out, okay, how do I translate data and models? Because this is something that is not applicable to business, but to actionable insights. And this is what we set out to do every time we work with our partners. So what we came up with is two strategies that can help you actually reduce those no-shows. The first one that we want to expand on is confirmation calls. But we already said, okay, confirmation is not as effective. And the reason it hasn't been as effective is because it's not scalable. You probably need hundreds of people in your front desk and your scheduling team just to do this work of the confirmation. What we can do with the model is make it way more scalable, optimize it so that you target only all these patients that are likely to no show with the model, and that can bring down the need for people from hundreds to maybe a couple, a few dozens, or even less people, depending on the size of your call center and your imaging center. And then the other one, which we call strategic scheduling, is more of similar to what the airline do. And what airline does is that they overbook some flights, understanding that some passengers will not show up, and obviously those passengers that don't show up represent significant added revenue to the airline. So what we're replicating with some of our partners is just overbooking maybe some slots, but using data science so that you don't piss off some of your existing patient base that are actually disciplined and show up on time to their appointment. So armed with this modeling, this data science approach, you can actually do things that are very well data oriented and that can yield the results desired. But now, how does all this translate in our experience to the bottom line, which is, as what business expect? And what we've seen, and we are showing here an illustrative case of a small, relatively small imaging center doing 30,000 appointments per month. If we can target that top 10% that we can perfectly identify with our model that shows off up to 90% accuracy, then we can prevent close to 25% of these no-shows, which in a year span may represent hundreds of thousands of dollars. And what we've seen in the past is that typically this amounts to an ROI of 6 times in the span of a year, which, me as a financially driven person, I can tell you is very, very interesting. But Carlos, I know some of our partners have expressed to you other benefits from reducing the no-shows as well.
Of course, and perhaps we can call them the tangible and the non-tangible benefits that come out of this implementation of these strategies. Some of the intangible, perhaps, are, as we have seen them, increased patient retention, which is essential because there's obviously a great deal of options out in the market. Patient retention means longevity. Shorten appointment lead times, which also contribute to flexibility because obviously the patients are able to come in and come out, and the implementation is a lot quicker. And then finally, improving the allocation of human resources. And when we talk about this, we want to include the equipment utilization. We want to include the radiologists themselves and their time because that is an essential commodity to the center itself. There may even be outsourcing some of the radiologists that are working with them at a specific point. So all of these intangible benefits have to be added to the tangible ones that basically represent a financial upside for the center itself. You stop losing, you're actually now making revenue. As we come to the final parts of our webinar, as we said at the beginning, the most important thing and the greatest feedback that we have are the questions. CCD Health has always valued the information of its partners, of its colleagues, and we'd like to now have this opportunity to take some of your questions. And I'd like to introduce another member of our team here at CCD Health, Maciel.
Thank you, Carlos, for having me. It is a pleasure. Today we have very good and interesting questions on behalf of the audience. And being the first one, getting right to it, and on behalf of our friends from Radiology Journal, what are the key points to better training schedulers?
Okay, so I'll take that one, Edison. So the key points of better training schedulers. Again, this is something that we take very seriously, as all of you do, because training is the most essential part of the lifespan of an agent. So for us, it's very important that the material, first off, the training material that the organization has to be very clear, has to be concise, has to be very poignant. More often than not, when we collaborate with a colleague or partner organization, CCD Health will look at that material, and we have a great deal of experience making it better, making it more applicable, making it more practical. Because at the end of the day, this is material that you have to teach. And so understanding that there has to be an educator in the training process, right? Not just someone that knows the material, but someone that knows how to educate around the material. Because it's important that the agent understand, obviously, regardless of what platform you may be implementing at the time, whether it's RIS or whatever, any RIS platform, whether it's Merge or eRAD, whatever it is, the agents have to be able to understand the material and apply it. And then finally, I would say that nesting is another essential part of the training process. The more nesting time that we can provide the agents, the more in tune and the more prepared they will be when they go live into an operational environment. You can never have too much nesting because when you want your agents that when they interact with their patients, they want to be able to be an extension of the healthcare provider at all levels.
Thank you for that, Carlos. The next question, and on that same train of thought, this is from Buffalo MRI, addressed to Edison. What are those tips to have a more efficient scheduling process and save time?
Perfect. I think it ties up nicely to what we were discussing. What we try to use at CCD is a data-driven approach in which we try to collect data points at a specific time slots in the process, understand and map out the process and see where these leakages might be. Typically, you'll see the patient experience is one that you have to be keen on, but also understanding how the flow of the process works. What are these key steps that the scheduler or the people at the front desk need to follow, but also understanding systems that you're using and how can they be improved. So all those come to that set of items that we keep an eye on to improve the scheduling process.
Thank you for that, Edison. Another very important question that I see here, and that really adds to what we have been discussing here. It's on behalf of Alliance Healthcare Services, and the question is, what are your suggestions on how to ensure that the patients show up?
Yeah, thank you for that question. I think the strategy that we've seen works the best is those confirmation calls, because then you need to remind the patients that they need to show up to their appointment or have an appointment scheduled for a specific time slot in a specific date. However, what we've seen in the past is that what works best is a data-driven approach, because you don't want to call them too early so that they forget eventually, but you don't want to call them too late that you don't have the flexibility and the time to maneuver and maybe backfill that time slot that will probably open up. So different geographies, different client profiles, have different patient profiles, have different time slots and different lead times that we need to address. So using a data-driven approach actually gives you the optimal time at which the imaging center should be calling that patient to confirm that appointment or to remind that patient that they have an appointment.
Indeed, indeed. Well, in that same train of thought, we also have a question on behalf of Vision Radiology. What are the recommendations on how to handle the same-day cancellations? I know we are quite aware of that. That's a very good one for us.
Yeah. Because when we set out to develop this model, what we had in mind is especially these same-day cancellations, because they are the most troublesome, right? Because you don't have the time to maneuver and backfill that slot. So the best way that we have identified is actually knowing in advance which ones of those patients are likely to no-show, and then just implementing one of those strategies that we discussed, or maybe another one that you can implement armed with the information in advance that, okay, this patient X has a very high likelihood of not showing up, of being a same-day cancellation. So I'm gonna be preventive. I'm gonna do some proactive approach to minimize the impact that patient X can have on my resource utilization or just my radiologist time.
Definitely, definitely. Well, last but not least, what imaging center size would benefit the most from this?
Yeah, that's a very good question. What we've seen is that imaging centers of all sizes can actually benefit from this type of approach. And what we've seen is the whole world is transforming to a more data-driven approach to doing business and managing business. So actually, any imaging center of any size can benefit. What we would advise, however, is some imaging centers that may not have that high demand, that may not have a lot of idle capacity. They may not see as much benefit from this type of model as imaging centers who are around the 70 plus% utilization rates.
And just to add one final piece to that, I think it's also important to understand that those centers that are disciplined enough to understand that the data speaks, and it speaks very loudly. In today's environment, with everything that's been going on, there's such a high volume of demand of patients, of testing. A lot of people from 2020, a lot of patients that didn't have their testing done are now, this is an avalanche of patients all over and at all times. And we find that a lot of our partners are overwhelmed at times operationally because they just have so much work. But they have to have the discipline, we feel as well, to have a team of people looking at the data, as Edison well pointed out, because the data at the end of the day is your best ally, and it's going to drive your best strategies forward. And so that's why it's so important.
Well, thank you very much, Carlos and Edison. Any further questions that we have not been addressing, have not addressed right now today, we are going to do so in an email in the next hour. So please enjoy the rest of the webinar. Thank you so much.
And with that, we come to the final part of our webinar series today, focused on no-shows. We would like to thank all of our colleagues that took part in today's webinar. And we'd like to remind you to please join us and mark your calendars for our next segment of our series to be held on Wednesday, June 23rd, at which time we will discuss the financial impact of drop calls and how to overcome them. With that, on behalf of our team here at CCD Health, I want to say one final thank you. Please feel free to reach out to us for any further information. And let's all together continue to increase the knowledge base of this wonderful imaging market that we all love. Thank you so much, and be safe, everyone.
Thank you, everyone, for joining. Have a great day.